Not everybody is that the case. So older people, people with underlying health conditions in particularly, are getting hospitalized. And Texas has had to cut back now and not be doing elective surgery anymore because their hospitals are starting to fill up. And that includes their ICUs. And so they're doing what we call a full surge. When we say surge in healthcare, we mean a surge so that we have to do different things to take care of our patients. Particularly Houston's hard hit. And so Texas Children's Hospital, a hospital for kids, now also admitting adults with COVID because they need the rooms and the space to take care of them. So that's a big deal. Anytime you have enough cases in your state that your hospitals are filling up and you have to take care of patients in a different way, that means that things are out of hand and out of control. The other states, the other three, it's not quite to that level yet, but they're watching things very carefully. What do all of these states have in common that are having the most trouble is early and, shall we say, aggressive openings. And so they curtailed their shelter-in-place orders earlier than others. And when they did so, they did it with gusto, and they opened up everything. So, you know, to compare it to here in North Carolina, we opened up, but there's still some things that we're still hesitant about. Opening up bars, fitness centers, and large groups of people. In fact, we felt so strongly about it, the Republican convention had to move on, whereas in some of these other states that has not been the case. Makes sense, doesn't it? We pushed down the curve. We pushed it down. We did that with shelter-in-place orders. And if you release that pressure, boom, what's it going to do? It's going to spring back up again. And that's what's happened. So where is it paradoxically a little better right now is in New England, upper Midwest, the areas that had the hardest problem with it earlier. And they haven't started opening up until just recently. They kept their curve pushed down much longer, made sure it was really down and that it was really on the downswing in the number of cases as well as hospital admissions. And then they decided to open up and more slowly. So for instance, New York, it's only been a week or two, I think, since they opened restaurants. And so they released later and they're doing better. So if this shelter in place, if this pushing down the curve, does it really mean that we have to go back to the way it was in April? And that was miserable. I even say it was miserable. You know, nothing was open. You know, you couldn't see your friends. Everything was pretty much shuttered down. The only good thing was traffic and the number of traffic accidents we were seeing. But no one wants to go back to that. So what do we have to do? We talked about it for a long time last week. Sheltering in place is not going to be what we want to do. So we're going to do masks and we're going to do personal distancing. It's a personal responsibility now rather than a community responsibility to push down the curve. So let's all do it together. Let's personally distance. Use the mask when we're more than 6 feet or less than 6 feet from somebody, particularly indoors. And I think we can do it. I think together, with our personal responses together, we can slow this down. So here in North Carolina, we've been kind of on a plateau for the last 3 weeks. Our number of cases per day is not necessarily increasing. There's a little up and down, but it's also not going down. And that includes their numbers of hospitalizations across the state. In the state, it's not just a big city problem. While Charlotte and the Triangle probably by numbers have the most, if you look in the smaller rural counties, they are having COVID too. And when you have a few cases of COVID in a county that doesn't have many people, that's still meaningful. Particularly our agricultural counties in the eastern part of the state are having a hard time right now. And so it's not just the big cities. Here in the Triad, Winston-Salem and Greensboro and our immediate area here, our cases have actually dropped a little bit in the last week or two. Is this something that means we're out of it? No, it just means this is going to go up and down a little bit. So maybe the last week or two is a bit encouraging. And our hospitalizations in our area are down a little bit too. This doesn't mean we can, by any means, we can let down our guard. And we need to continue to personally distance, wear our masks, not participate in large gatherings. Some other interesting things that we've learned in the past week or two, protests. We were all worried about COVID outbreaks being associated with protests. And as you know, all these protests that I know of were outside. And a lot of them were done fairly responsibly. Not all of them, but a lot of them. And to date, there's only one known cluster of cases associated with the protest, and that occurred in South Carolina. And so maybe we dodged a bit of a bullet. You know, protests are outside, and that helps a lot because the virus can disperse if present. So I don't know how it feels to other people, but I'm a little bit embarrassed right now in that other countries in the world have had to restrict access to the U.S. And U.S. citizens from coming in. And I mean, this is most obvious with Europe and the European Union, but also a lot of countries in Asia, Canada. I mean, the list is pretty long of people who don't want U.S. citizens or U.S. People right now. And this has nothing to do with politics. This has nothing to do with that these countries don't like us, because I can tell you that a lot of Europe would love to have our tourist dollars, and they like Americans. But this has to do with there's just too many of us here who are infected, and we're a risk to the rest of the world. I can't think in the history of the world of another time where U.S. citizens have been excluded because of disease. We've done it else, backwards. Ebola, people from afflicted areas of Africa, so on and so forth. But it's never been this way now, and we could be like those countries. We just have to take our personal responsibility now to light and really work with it as individuals to get our case numbers down. If we can get things pushed back down again, then we can do aggressive testing and aggressive contact tracing, and it'll work really well. Right now, because there's so many cases, even though testing and contact tracing is still heavily encouraged, the impact of it is not as great as if we could get our cases down through personal distancing, avoiding large crowds, and using our masks. So, so what about, so it's vacation time, so what about travel? Let me bring up a study, or it's actually 3 studies that came out that I was looking at this week about air travel. So, people are saying, is it safe to fly on a plane? It's a very good question. And the planes are starting to fill up again, so how safe are they? Well, since the beginning of the worldwide COVID pandemic, there has been only one reported and known cluster of infection occurring on an airplane, and that's not because we're not looking, because they're very visible, and we keep traces, and we have a whole section of the CDC who's responsible for looking for these. But the one cluster that happened was a flight, I believe it was Hong Kong, where there was a COVID positive person on board who affected 11 or 12 other people. And that was fairly well described. But it was a long distance flight, international, and it occurred of all places in business class, which you'd think might be a little bit immune from that. But that's where it was. But there's been a lot of investigations involving people who were COVID positive and were on an airplane, either symptomatic or asymptomatic, and then that was discovered at the arrival airport, and then they did look-backs and quarantined all the people on the plane and tested everyone sequentially and did a look-back. And in two of these investigations, there was absolutely no one else on the airplane who was infected, even though you would have thought there should have been, right? Because there was a highly symptomatic person in close quarters with other people. And so, you know, airplanes have an interesting laminar airflow. They HEPA filter their air. And now everyone's wearing masks. And so, you know, I won't say that air travel is safer than your car. It's probably not. But maybe it's not as bad as what some of our worst fears were for it. So we'll have to keep track of that. Certainly, if you are planning air travel with your vacation this summer, there's things that you can do to make it even safer. You're going to have to wear a mask. I think all the airlines are requiring that. If it is possible, get on a less crowded flight and distance yourself from other people who are not parts of your immediate family, if you can. The shorter the duration of the flight, the safer it is. So, you know, a short hop up to DC is safer than a long distance haul to Seattle. And then hand sanitize frequently and or wash your hands. Keep your airport time down to a minimum. Get in and out. Transportation, have a family member pick you up at the airport, or don't ride in shuttle buses with a lot of other people. You know, try to keep your taxi just to you and your immediate family. Get to your destination, and then be safe at the destination. Practice your social and personal distancing. Wear your mask. Stay out of large gatherings. Visit people you know rather than people you don't. I don't know why people would visit people they don't, but you know, if you're going to a large party or something, I guess. And you know, just a lot of that's just common sense. So as we get into 4th of July, those are some things to think about. Other 4th of July activities, anything outside is cool. It's going to be hot here in the Triad. Stay in the shade, but being outside, if you're going to have a barbecue or meet a few friends, keep the numbers down, less than 10, and personally distance and do it outside. You can go to the pool, but practice those same things while you're at the pool. And you might want to limit your duration rather than, you know, 12 hours at the pool, make it 2 hours. And so again, a lot of this is just common sense. So we don't want to see 4th of July be like Memorial Day was for us, which was a rude awakening, and which is what got a lot of these in trouble states in trouble right now. That's when their rates started to go up. A little bit about the science. What's new in the science of COVID? So there's been some stuff in the papers about a new clade, a new strain, a mutation of the SARS-CoV-2 virus, the virus that causes COVID, that has now overtaken the world. Boy, man, that would make a great title for a horror movie, wouldn't it? Mutated virus takes over the world. But it's really not like that. So what the study found is there was a single amino acid change in one part of the virus, and that part of the virus had to do with the part that binds to the receptor in our lungs. And so people said, could that have made it more transmittable? Is that why this strain, this clade, came to take over? A lot of debate about that. There doesn't seem to be a lot of real strong epidemiologic data that suggests that the virus that's circulating now is more transmittable than the one that first circulated in China. I don't think it's all that different. And so if there's a new strain of the virus going around, or a new clade of it, it probably is more like changing the chrome on a Toyota. The car is the same, and the car goes just as fast. It does just the usual things it does. It's just the bumper's a little different. And I think that's all that's going to mean. So this is not a dangerous mutant ready to take over the world. So take a deep breath. We're okay. Other things that have gone into science, we've really been learning a lot about how this virus causes disease in people and who it causes disease in. So it seems like about 80% of all of the people who get COVID get it from 20% of the people. So these large transmission outbreaks, these large transmission events really are important. And a lot of these are in close quarters, a lot of these are indoors, a lot of these also are in extended families. And so it's not uncommon to see 8 people get it all together from one person, rather than one person give it to a bunch of people on the out. So that's kind of good news, because if we can get a hold of that one person through testing and contact tracing and then isolation, we can cut off that node, that cluster. We can cut it right off before it can really expand in these large outbreaks from these small number of people. The other thing we've been learning about in the science is how the virus causes the actual problems in a person. It's interesting because, you know, there are other parts of the body that are affected other than the lungs. One's the nervous system and our brains and our nerves. And so one of the minor perturbations of this is the loss of taste and smell that sometimes we see with COVID. But there are other effects that happen in the brain sometimes from just problems with thinking, severe fatigue, excessive sleepiness, which can progress in some people to full delirium or losses of consciousness. And now that's not in most people. It's probably only about 20% of people who get COVID. And it seems to be mostly in people who are in the ICU for long periods. And staying in an ICU for a long period is hard on the brain, even without COVID. So it's a little hard to sort out how much of it's the ICU effect or ICU delirium versus COVID delirium. But I think there is something to it. When you look at why these people's brains aren't functioning as well, it seems like it's not as much that there's actually virus in the brain or inflammation from the virus in the brain. So it's not an encephalitis or a meningitis, but it seems to be more tiny, tiny, tiny little clots that are occurring in the capillaries in the brain, and that cuts down the oxygen delivery to the brain, which interferes with its function. So we could probably use that information to help with oxygen delivery and with preventing these tiny clots, and there's a lot of work being done on that right now. So I think that as time goes on, we're going to be taking better care of our patients with COVID because we understand the science better and we understand what to do and medicines that might help, including, we talked about last week, steroids and higher dose steroids for short periods of time in people with COVID does improve mortality. And we hope that that's borne out by other studies, but a lot of places, including the hospitals in our region, are doing that now, and I think it's helping. Down the road, I think we're going to be seeing more treatments coming out, and the studies are advancing. Yes, I possibly see a day where we have like a Tamiflu for COVID, a pill that you could take early in the course of infection to reduce the amount of virus that replicates in our lungs and the effects and the microclots that then follow from that infection. So I'm optimistic on that one, but it's going to take a while yet because those drugs are just starting their clinical trials and we don't even have early data yet. So maybe by the fall. Will we have a drug that treats both COVID and the flu at the same time? Wouldn't that be neat, because the symptoms overlap a lot? Maybe. There are some anti-flu drugs that are being evaluated for flu, so it's possible. That one may be a little bit further of a reach, though. Vaccines. We have a study that was done in a small number of people from a vaccine produced by Pfizer. Some of you might have seen it in the news. It's an RNA vaccine, which is a kind that we haven't used before. This type of vaccine actually puts a little bit of the copy of the virus into your body, the part that doesn't cause disease, only the part that expresses the proteins that our body recognizes, and then we then make antibodies to that. So the vaccine in small numbers of people had pretty good antibody responses. Most of those antibodies were neutralizing, which means they grabbed the virus and knocked it out. And then if you give a second vaccine down the road a little bit, it actually boosted the antibody responses to higher than what we get with the natural infection. And that's what we want to see with the vaccine. A little bit of a downside to the vaccine is that, particularly in the higher doses that people got, there were a fair number of people who got fevers that lasted a day or two from the vaccine itself. But I don't know about you guys. If it's just a day or two of fever, I can take Tylenol for it, and then I'm immune to COVID, I'd probably get it, because we would accept that in other vaccines. So those are some of the good news aspects about what's going on right now. I have two other things I'd like to say, actually three other things I'd like to say before wrapping up. And that is school reopenings. I know there was a kind of a sigh, oh no, we got 2 more weeks before the governor's going to tell us how we're going to reopen schools. And that announcement was yesterday. And you know, I think they're still trying to work out some of the details and also kind of look at, you know, where our numbers are going in the state. So we'll have to wait and see how that comes down. I do think that schools can be reopened safely. We're seeing a lot of other countries who've been able to do it. And I think that it's going to change the way the classroom looks. It's going to change the way a little bit how the schedule is done and with extracurricular activities. But I think it can be done. It does mean, though, that we're going to have to accept a few cases that might occur in our school systems. So if you have 1 or 2 cases in a school, you deal with it, and you do the standard epidemiology around that. And then you take those students and the people around those students, you isolate and quarantine, and rather than shut the whole school down, you work with just the affected groups. And this can be done. I have a lot of confidence we can do that for our schools. Because we do this all the time. We have whooping cough that happens in schools. What do? We identify, we isolate, we quarantine the exposed people. We have outbreaks of chickenpox in schools, and we deal with it this way. And so we have a lot of communicable diseases we're used to finding, seeing, and taking care of in our schools. And we don't shut down our whole school system for any of those. So I think we can do it for COVID too. And I think that if we can get our numbers down further through wearing our masks, personally distancing, avoiding big crowds, staying away from the parties, I think that if we can push our curve back down again, I think that is a really good thing if we can get our schools open. And Kellyanne Conway, was one of President Trump's spokesmen, said the other day, and I agree with her on this one, that keeping our bars closed is a great, if we can keep our schools open but have our bars closed, that's a good trade-off. And I agree with that. I can think of nothing in our society that if we can do anything with this COVID, if we can keep our schools open, that will be a huge success for us. And we really need to do that. So if there's anyone in Raleigh listening, let's do everything we can to get our schools open. And it's not just so mom and dad can go to work. It's for our kids, because they need that. And we don't want them falling down academically. We don't want them falling behind in their social development. So we need to do that. So that's the first thing I wanted to say. The second thing is I'm going to make a proclamation. And you guys can all hold me to this in the future if you want, because I'll just disavow I ever said it. But I'm going to make a proclamation. I think that a lot of our problem right now here in the U.S. with living with COVID rather than trying to fight against it is because we don't know when the end is. We don't see that. We don't see an end, and we don't know when it'll be. So it's kind of like, well, I'm going to give up. You know, this is just too hard, and so I'm going to just give up. At least I'll be fine because, you know, I'm not a high-risk person. But so if we could have an end sight, we know kind of where the finish line is going to be. Maybe that'll make it easier for people to hunker down a little bit and hang in there. It's kind of like running that long race. If you know where the finish line is, it's a lot easier to just keep going and have the resiliency to get through it. And to now, I mean, no one's really talking about a finish line. So I'm going to give us a finish line. And it's a little bit risky because I could be wrong, but I'm going to give us a finish line. So I see kind of where the vaccine might be coming out. I think optimism in the very early part of next year. I see some treatments that might be coming out, optimism. And so we can help people early in their infections. And I see a bit of herd immunity maybe coming up as we get through what I think will be a nasty winter with COVID. And you put all these things together, when might an end date be predictable? So I'm going to give it is July 4th, 2021. That's the finish line, okay? Now I may be wrong, but I think there's some stuff coming together by in the middle of the summertime. Next summer, we're going to see some lights on the end of the tunnel, and it's going to start getting easier for us. And why not July 4th? It's Independence Day. So let's make that, or put that on your calendar, highlight it, big red smiley face, July 4th, 2021. I think if we can get to that point and have the resiliency. So I know it may seem a little bit further off, but at least it's a finish line. And after that, then it's going to be smaller things and smaller changes in our lives rather than the big ones. And lastly, I want to say, so as far as our media briefings and our briefings, so I will be away for the next 2 weeks from being able to do briefings. And so I think we'll be okay in the next 2 weeks, and I apologize for that. But I'm not going away permanently, and I will be back. And let's see, 1, 2, 3 weeks from today, and we'll catch up, and we'll talk about all the things that have happened in the sleepy month of July. So with that, I can take questions, if you have any.
We have a question on Facebook. Somebody's asking, how safe is it to come back to hospitals for tests and procedures? Can you address that?
Yeah, how safe is it to come back to hospitals for tests and procedures? Yeah, very safe, actually. The number of patients that have been infected with COVID while in the hospital in our entire Triad area has been less than a handful over the entire outbreak, and all of those were asymptomatic that I know of. So they're very safe. In clinics, surgery, outpatient, and we really would like people to come back, particularly people who have ongoing chronic medical problems, because you need to get checked up and you need to get going back on your long-term treatments and monitoring and such. Same thing for delivering babies, extremely safe. So I'm very encouraged about that. And that's here in the Triad, but it's also all over the country. So what we do with PPE and what we do to protect people work. All right, call it a wrap. Thanks, everybody.